1,501 people in the hospital, and sadly, 4,852 people who have died. As North Carolina families wrestle with the sickness and death caused by this virus, we keep them in our prayers and send strength their way. North Carolina's COVID-19 numbers remain too high. Our percent positive has crept back up to around 8%. The weekend saw our highest day of reported cases, and today we have the highest rate of hospitalizations since the pandemic began. These are numbers we cannot ignore. But other states have been even worse right now, and they should be the canary in the coal mine for us. Last week, we took action to lower our indoor gathering limit to 10 people because we know this virus spreads more easily indoors. Capacity limits remain in place for retail stores, restaurants, entertainment venues, and other businesses. We continue to tell people to wear masks and stay distant, and stress enforcement of those critical rules. Today, we're introducing a county alert system to identify North Carolina counties with the highest levels of community spread and offer specific recommendations for how working together with us can bring down their numbers. Counties of concern are designated as red, orange, or yellow, using a combination of 3 specific metrics that Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, will detail in just a minute. These are from the same set of metrics that we use every week to give an update on how North Carolina is doing with COVID-19. This system will help our counties make decisions about what more can be done to slow the spread of the virus. The system also includes additional recommendations for individuals, businesses, community organizations, and public officials on actions that they should take. Simply put, this new county alert system shows our state's viral hotspots. But let me be clear, the entire state is experiencing widespread transmission. Cases across the country are surging right now, overwhelming some hospitals, forcing states to go backward with their COVID-19 restrictions. Right now, North Carolina's metrics are increasing, not surging, but a surge can happen quickly. If officials, business, community, and faith leaders, and people who live in these orange and red counties can work with us to take effective action to bring down their numbers, we can protect our state's hospital system and save lives. And it can prevent us from having to take significant steps backward. I'd like to ask Dr. Cohen to present more detail on how the state developed this map and what we're recommending to these counties. Dr. Cohen?
Thank you, Governor. I am concerned about where we are as a state. Today, we once again surpassed 3,000 new cases in one day, and our percent of tests that are positive continues to climb. While our hospitals have capacity, they're feeling the strain, particularly in the Triad area. Even accounting for the federal change in how hospitalizations are reported, we are seeing more people needing hospital care than ever before. As you noted, Governor, COVID-19 trends in many parts of the country are even worse. More and more states are tightening restrictions, not allowing people to gather indoors with anyone outside of their household, closing indoor dining, asking residents to stay home except for essential trips, and more. Here in North Carolina, we hope to avoid having to take such actions. The COVID-19 County Alert System that we're introducing today is one tool to help us slow the spread of the virus right now. Today, I'll walk you through the details. All North Carolina counties are experiencing high levels of community transmission of COVID-19, but the virus is impacting some counties even harder. You can see this already on our dashboard right now, which shares county-level data for cases, percent of tests that are positive, deaths, and other metrics. This new COVID-19 County Alert System makes this data more visible, more understandable, so North Carolinians can easily see how their county is doing. And it provides a list of actions, again, that individuals, businesses, community organizations, and public officials can take to slow the spread in their county. So let's take a look at the metrics behind the County Alert System. Because no one metric provides a complete picture, we use a combination of 3 metrics to categorize counties. The metrics are informed by the White House Coronavirus Task Force and North Carolina's key metrics that you're familiar with. The first metric is case rate. Here, it is adjusted for population in the county, so we can compare counties with different sized populations. The metric is the number of new cases in 14 days per 100,000 people. This is the same measure that the White House Coronavirus Task Force uses to compare counties and states. The second metric is the percent of tests that are positive, and everyone's familiar with that one. The third metric is a hospital impact metric, and this is a composite score based on the percent of hospitalizations that are for COVID, COVID-related visits to the emergency department, the number of staffed and open hospital beds, and critical staffing shortages over 14 days. I want to thank our hospital partners who worked with us to determine how to best measure the impact of this pandemic on hospitals at the county level. So we use a combination of these 3 metrics that I just went through to categorize counties into 3 color tiers to describe their level of viral spread and healthcare capacity impact. Red is critical, orange is substantial, and yellow is significant. On this slide, we show the cut points on those metrics we utilize to categorize counties into their color tier. Every county in the state is experiencing community spread, and so to move from yellow to red or orange, 2 things have to happen. First, the county has to meet the criteria for its case rate, meaning more than 100 cases per 100,000 for orange, more than 200 cases per 100,000 for red. Second, the county has to also meet at least one of the following criteria: either an elevated percent of tests that are positive or an elevated hospital impact. For example, if your county crosses the case rate threshold, and in the left-hand column, and its percent of tests that are positive is between 8 and 10%, or the hospital impact score is moderate, your county will be orange. As we move to the next slide, you can see a map of the state showing which counties meet the criteria for red and orange. We have 10 counties that are red with critical community spread, and 43 counties are orange with substantial community spread. And the remaining are yellow with significant community spread. No matter the color of your county, there are critical actions we can all take to slow the spread, starting with everyone wearing a mask whenever you're leaving your home. But it doesn't stop there. Everyone has a responsibility, each North Carolinian, each business, each public official in each county. Red and orange counties need to do even more to slow the spread of COVID-19 in their communities. And in the next few slides, I'm going to highlight some examples of the recommendations for the red and orange counties that go further and build on top of the already existing executive orders and guidance from the Department of Health and Human Services. So if you live in a red or orange county, you can help slow the spread and protect your loved ones by limiting social activities with other households, and minimizing the number of people in your social circles. Reduce your public interactions to mainly essential activities and avoid settings where people congregate. For businesses and community organizations in red and orange counties, they should be using telework wherever possible, canceling non-essential work travel, participating in the Count on Me NC training, and avoiding all indoor meetings or events or gatherings above 10 people. Public officials can expand free state-funded testing events. They can increase the availability of non-congregate housing so people who need it can have a place to isolate or quarantine. They can increase enforcement of gathering limits and masks, and they can also adopt local ordinances with civil penalties. A full list of recommendations for all of us and the additional actions for red and orange counties is included in today's alert. The state can also provide additional support. Counties are not on their own. We can help with sharing messages about prevention. We can work together on enforcement. We can ramp up testing together, support our local health departments, and allow support services so people can afford to stay home to isolate or quarantine. The COVID-19 County Alert System is now posted on our website. Moving forward, we will publish this report monthly. Counties that are identified as meeting the criteria for red or orange tiers will stay in those tiers for at least 4 weeks to give them time to make progress. Today, I covered a lot of ground, but the bottom line is that the COVID-19 County Alert System gives North Carolinians an easy way to see how their county is doing and to know what they can do to protect their family, their neighbors, and slow the spread of this virus. With promising news on the vaccine front, we need to do what we've done throughout this pandemic: work together to avoid the threatening situations that many other states are facing right now. I know we can do this because time and again, since our first case in March, North Carolinians have done exactly that. Thank you, Governor.